Welcome to Lotus Medics. I'm Dr. Sachin Kotasthane. I'm an obstetrician and gynecologist. I'm currently covering obstetrics and gynecology in the Central West New South Wales, mainly covering Orange and Bathurst and the surrounding areas. Welcome to yet another educational video from Lotus Medics. Today we're going to talk about a procedure called endometrial ablation. What is endometrial ablation? Let's look at the words. Endometrium is the inner lining of the uterus, and ablation refers to destruction of something by application of heat. So essentially, endometrial ablation refers to destruction of the lining of the uterus by application of heat or radiofrequency. When is it offered? Endometrial ablation is a minimally invasive, less invasive option of management for a woman who has heavy menstrual bleeding. In the past, major surgeries like hysterectomy were the only options for women who had heavy bleeding. But over the last more than 20 years, we have less invasive options like endometrial ablation, which has meant that women don't have to undergo major procedures like a hysterectomy. An endometrial ablation can either stop or significantly reduce the heaviness of women's menstrual bleeding, thus improving their quality of life, improving their iron levels, and reducing the incidence of anemia or low iron. What are the contraindications to an endometrial ablation? An endometrial ablation is a treatment that is most suitable for women who have completed their families. Any woman who is pregnant or who is desirous of being pregnant in the future or retaining her fertility should not have an endometrial ablation. The endometrial ablation causes scarring in the internal cavity of the uterus and makes any subsequent pregnancies very dangerous, both for the mother and the baby. The endometrial ablation is not a contraceptive. The endometrial ablation is also not suitable if you are having unscheduled bleeding, which has not been investigated. It is for this reason that your gynecologist may organize extra investigations like an ultrasound scan of the pelvis to check for your endometrium, as well as biopsy of the endometrium to rule out any endometrial precancers, hyperplasia, atypia, or malignancy. In presence of these conditions, the endometrial ablation is not the ideal treatment for you. If you are having any pelvic infections, you cannot have the endometrial ablation, which will have to be deferred. If you have an intrauterine contraceptive device like the Mirena, again, the endometrial ablation is not an ideal option for you whilst the Mirena is still inside the uterus. Any procedures that can thin the uterine musculature, like a classical cesarean section or having a previous fibroid removed, are also contraindications to an endometrial ablation, as these can thin the lining of the uterus and make it unsafe. You may also have a very small cavity, in which case the endometrial ablation may not be successful for you. In certain situations like large fibroids, endometriosis, adenomyosis, and large uterine cavities, the efficacy of the endometrial ablation is significantly reduced. Let's look at how an endometrial ablation is done. Once you're deemed fit to undergo the endometrial ablation procedure, your gynecologist will obtain an informed consent. Part of this consent is going through the procedure with you. As an endometrial ablation is not a contraceptive and is only deemed fit for women who have completed their family, your gynecologist might discuss any contraceptive needs with you. These may involve discussing any permanent contraception like a sterilization, or maybe a salpingectomy, which is removal of your fallopian tubes, or maybe getting you to consider your husband having a vasectomy. The procedure is done as a day case procedure. It's done under a short anesthetic. The first part of this procedure is a hysteroscopy, wherein a camera is inserted inside the womb and the womb is checked for any polyps or fibroids. The womb dimensions are measured. The endometrial ablation device, called the NovaSure, which is like a triangular netting, is inserted inside the uterus. The device is opened inside the uterus and the measurements are taken and recorded on the device. A safety check is then done to confirm that there is no internal injury. Once the device passes the safety test, radiofrequency ablation is performed by the device, which successfully destroys the lining of the uterus by ablation. The device is then withdrawn and the patients are taken to recovery. After the procedure and before the patient is woken up, a check hysteroscopy is usually done to confirm that the procedure has been uniformly successful, to look at the extent of the ablation inside the uterus, as well as to rule out any inadvertent injury. The procedure can be done even if you are on your menstrual period. So if you're on your menstrual period or are bleeding, please do not cancel the procedure. There are certain special circumstances which may pose challenges during these procedures. As discussed before, there are fibroids, endometriosis, and if someone's had a previous endometrial ablation. Please speak to your GP and your gynecologist about these special circumstances and if an ablation is still suitable for you in this regard. We at Lotus Medics will make sure that we organize a follow-up with you after your endometrial ablation to discuss the procedure as well as any follow-up. We will review you in a few weeks to make sure that your menstrual cycles have indeed either disappeared or are significantly lighter than before. It's not unusual to have a first period or so slightly heavier due to disturbance of the endometrium. But over a period of time, your menstrual cycles will either not exist or be very, very light. If you continue to have heavy bleeding or unscheduled bleeding after an endometrial ablation, or significant pelvic pain after an endometrial ablation, you may need further assessment and treatment. Please do not hesitate to contact your GP or your gynecologist if this happens. I hope you've enjoyed this video and have got some information about an endometrial ablation. If you have any further questions, please do not hesitate to go on our website www.lotusmedics.com.au. The information leaflet on endometrial ablation is right there. Thank you.